Hello, how is everybody? This is my first YouTube recording, and I just wanted to get started today because I've had a bad day today. And I thought, I look rough, my t-shirt is wrinkled, I got a pimple the size of Texas on my chin, my hair, I don't even know what that hair looks like, but anyway. I look better than I feel today. I'll say that. Not that I'm that sick today. I've just had one of those days. Got up, had some things I wanted to do in the house. I gave out and wasn't able to do them. Finally came down and sat down and took my temperature and realized I had a temp, and that's why I wasn't feeling good today. The realization that you have some sort of I want to use the word monster, but that's not really what I mean to say. Some kind of something going on in your body that has taken control and is, at least of your function, your body function, taking control. I know God is in control, and you no longer have the ability to push through it the way you always have in life. It's tough. Tough. Can't rest enough to get rested. Can't sleep enough not to be tired. But the good thing is that a diagnosis of cancer, and even more specifically, a life-limiting diagnosis, certainly brings everything in perspective. Priorities, all of a sudden, you don't have to work to figure out what they are. They just bubble to the top, and you know what you want with the rest of your life and how you want to spend the rest of your life. And it doesn't take a whole lot of worksheets and seminars and things to figure out all of a sudden how you want to be remembered and what's your purpose in life. You know, I'm thinking, what was my purpose in life anyway? You know, and what do I need to do with what is remaining of it? And I have those answers. And part of that is this YouTube videos. This one is a little longer than they would usually be, but I just want to give you a quick. I've had several people ask me, what type of leukemia do you have? How do they test for that? And all that. The end of October, I went into the hospital with chest pain. The pain was related to my spleen, not my heart, thank goodness. But they quickly, still in the emergency room, the ER doctor came to me and said, Miss Pewter, you know you have leukemia. And I said, yes. I've been told by my primary care physician that I probably did, and we've been waiting. I said, I've waited, about 2 years to be seen by the oncologist because I knew that it was going to be a watch and wait situation, and that until the leukemia started to replicate quickly, then there was nothing. They wouldn't do anything. They wouldn't treat it. So I went just in time, as God would have it. And at first I was diagnosed with chronic lymphocytic leukemia. And I was looking at the support groups. Any type of cancer that you have, most likely there's a support group on Facebook. And I recommend that you look for those because friends and family and everybody want to help you with advice about cancer. But cancer is very specific. So if you have leukemia, all leukemias are not the same. All lung cancers are not the same. So everybody's cancer diagnosis and everybody's cancer treatment is going to be different depending on the type of cancer you have, the the stage of cancer you have, where you're being treated, and just lots of other things that come into play. So a support group that's specific to the specific diagnosis that you have is probably your best bet when it comes to getting recommendations as far as specialists and how to go about seeking treatment, and sometimes what your blood work and things mean. They can even help with that sometimes. But I warn you that the support groups sometimes come how do I say this, interfere with treatment. Not that they interfere, but people see the support group as maybe more authoritative than their personal physician. And I would warn against that, because everybody's situation is different, and you will get a lot of advice. A lot of that advice you cannot take because it does not relate to you at all. I went into the hospital. I was diagnosed with chronic lymphocytic leukemia. CLL has a much longer survival rate. It's a much slower moving cancer. If you have to have leukemia, I was told it's the best type to have. So I thought, well, okay, I do have leukemia, but I'm going to live a normal lifespan with it. But then I got looking at the support group, and I got to looking at how people were living with this disease that I had been diagnosed with, and I thought, if I have that, I've had it a long time, and I have a really bad case, because these people are just not, their experience is not the same as mine has been. So a month later, I went back to see Dr. Gore in Union City. Much longer than it would have been, because I was exposed to COVID, so I had to wait 2 weeks to go in to see her. She came into the room and told me that I had T-cell prolymphocytic leukemia. Not good news. Some people with this disease live 5 years. Some people live 7 to 9 months. The lifespan with TPL varies according to, I think mostly of where you are in the disease when they find it, and how you respond to treatment. Treatment meaning treatment with Campath, which is the drug they use to treat it primarily. I was not fortunate enough to be able to use Campath. I had a reaction, some very severe reaction to it, just right away, like 1.5 milligrams into it, just almost none at all. I had a severe reaction, so that's not going to be an option for me. And in order to have any time, survival time with this disease, you have to have the Campath and then a stem cell transplant 6 months or so later. I was never thinking that I was going to have the stem cell transplant. That was never something I was really expecting to have be successful. I did expect to be able to have treatment with the Campath. Didn't know whether it would work or not. It doesn't always, but I was willing to try it. No go on that. So from here, my option is Dr. Gore in Union City has said she's not comfortable treating me. She's not going to treat me. She's sending me to Vanderbilt. Vanderbilt doesn't have any miracles. And I know that. This is just a type of cancer that is resistant to treatment. It will always come back. If you're able to go into remission with this, it won't be a long time before this disease comes back, and it comes back with a vengeance. So, knowing that, my family and I have come to grips with the fact that my lifespan, my survival period may not be a long time. You know, it may be, because I think I've already had it about 3 years. So I've already outlived most people. And I'm still strong. I'm still, fighting it. So we'll see. We'll see. But my point is, this channel is for us, those of us who are living with cancer, whether it be TPIL, which is what I call the disease that I have, or be it the other types of cancer that so many of my friends and family members are dealing with, have dealt with, are survivors of. I think it's important that we share with each other the realities of living with this, not in a way to be maudlin or wallowing, but just to be real and to support each other and to say, it's okay. It's okay when you have days that your hair looks like this and your t-shirt is wrinkled and you don't have any makeup on and you just look like a mess and feel like a mess inside and out. It's okay. We have those days. It doesn't mean that we're not doing this right. It doesn't mean that something's wrong. It just means that we're human. And a cancer diagnosis is a great big bag of rocks to carry around. And I believe in the power of prayer. And I believe in the presence of Jesus Christ and the strength that He gives me on a daily basis to fight this thing. But I need sometimes friends and family members to support me in prayer, and they do. They do. And that's one thing that I would ask you to do is, if you're struggling with not just cancer, but any kind of serious illness, please post here and allow us to pray and believe for you. And if you have something you would like to add to this channel, please send me a video and I'll upload it. This is not just about me, but it's about us, those of us in the fight to have life at its very best with a diagnosis that is pretty much the very worst. But we can still do that. Can still be done. Okay, I'll shut up now. Bye.